Welcome everybody to the June meeting of the Commission on Aging Well. I'd like to call the meeting to order at this time. Our first agenda item is to approve the draft minutes from May. After reviewing those, does anybody have any additions or corrections?
No.
If not, do I hear a motion for approval?
So moved.
Second.
All in favor?
Aye.
Opposed? Approved. Okay, I do not see anybody here for public appearances for non-agenda items. So we'll move on to agenda items with the summit, the Healthy Aging Summit that several of us were at. Jill?
This one's mine. Okay. It's much like my first rodeo. Okay, several of us were able to attend some of the sessions in the Healthy Aging Institute, the Aging Summit, which is put on by WIHA every year, the Wisconsin Institute for Healthy Aging. And it was really exciting to see some interest. There was a lot of great sessions, and so we were all able to split it up. And so I thought that, we would briefly go around and just talk just a little bit about what session we attended and what we learned from that. And then, maybe behind the scenes, you guys can share more with me and things that we can incorporate in our plan for growth and that sort of stuff. So, maybe I'll just start off with some of my notes. It was, sometimes you walk away from those virtual or those trainings and you're like, that was not valuable. But I really thought this was pertinent and really helpful. And so I thought the main speakers were really good. I think that, they talk a lot about partnerships. They talked a lot about social isolation, COVID, and kind of how to get through that and moving forward. And I guess I walked away thinking we're doing a lot of things right, and then I did glean some ideas too of things that we can improve upon. So one of the sessions that I attended was called, let's see, where's my notes? All good. I got it all typed up, but maybe not. Okay, so the first session I attended, because I remember everything I did, was called Developing Age-Friendly Communities, the Wisconsin Experience. No, I don't want to talk about that. So I am going to say, in between trying to virtually watch all the sessions, I had some issues. I'm a caregiver for my parents, and I got calls from nurses that day. And so I was stepping away from my computer many, many times throughout the morning. It was nice to be virtual because I could, just chime in on a few things. But so I didn't get to do that one. So the next one that I did get to sit through was Still Standing Wisconsin. Oh no, that was you. There it is. Sorry, I'm a little kooky. Where's the one I went to? Sorry. Oh, meditation. Meditation was more of a personal kind of a self-care thing. I don't think there was anything glaring about that, but I can tell you during COVID there was a lot more emphasis with myself and my staff about self-care and being able to maybe work at home and flex our schedules and think about how you incorporate your life into your work where, it's kind of like a teacher when you have a lot of people at you all day long every day. I think we didn't realize how much energy it takes. And so not having everybody there was a bit frightening during COVID. But it was kind of refreshing to kind of just regroup. And so easing back into the workforce and, we are flexing a few afternoons a week where we go home and we can do all the reporting and I can work uninterrupted. And I think we'll be more productive and healthier and it's just good self-care. So that was that one. The other one, though, was the one about the OT and the PT therapy. Developing partnership. Where is it? Oh, the unique role of rehabilitation therapy in older adults. Anyway, it was PT and OT, and they had a lot of talk about what that can do for our community, and other things that occupational therapists and physical therapists, presentations that we can invite them in for. And it talked a lot about partnerships in the medical community. So on the good side is, we have a partnership with Edgewood nursing students to do the patient advocacy, which has been fabulous, and that will continue. And then recently this year, we are partnering with the School of Public Health and Medicine, and we have 2 medical students that did virtual programs, and we'll continue that. So I feel good that we have these partnerships developed and that we can continue to grow. The medical students did a lot of some health and some fun presentations. I think Marcia attended some of those, so feel like you can chime in. They were virtual, but I think it's a win-win. These students are getting a feel for relating to older adults. It's taking them away from all the medical training and just the hands-on, how do you work with people and how does that work? So we have 2 new students coming on in July, and I'm going to incorporate some of the recommendations from the PT and the OT to these students about what they can present to us. I didn't realize you could reach out to an occupational therapist if you're starting to have mild cognitive impairment. And I thought that was fascinating. They talked a lot about a program called CarFit. So we've done programs where we've partnered with, I think it's AARP, but we've had car checks. They check your tires and they check your lights and that kind of stuff. But CarFit is how do you fit in your car? And it's actually more of an evidence-based program. And so I'd like to incorporate some of that. The PTs and the OTs talked about training for caregivers that might be moving, trying to transfer their loved one or help them up. And how do you do that safely without hurting them or yourself? The other thing was adaptive aids. And when we talk about aging well in your own home, sometimes you need to look at the raised toilet seats. Sometimes you need to make sure you have those grab bars. And you talk about that for, somebody needs that. But I think we need to look at more of the preventive side. Like, come in, you assess the home, the PT can, and say, here's some things that you might want to think about moving down the pike. And so just a presentation about adaptive aids. And then they had one just on compression socks, which I think that's really interesting because we had someone come in and say, how do I get these on and where do I get them? And, and so it just kind of opened my eyes to some other things that therapists can do. They talked a lot about what pays for it and how you get it paid for by Medicare and that kind of stuff too. But that was pretty fascinating to me. And then again, I got a call. It was just a bad day for my mom, but so I missed my 3rd session, but I did get the closing, and it was kind of there was representation from WEHA, Dave Nelson, who is the executive director of WEHA. And then they had Carrie Mulkey, who was with the Department of Health for the state. And it just talked about that collaboration and how there's a lot of us out here providing a lot of services, but how do we come together to make sure that we're all working together? And one thing I noted, though, is that senior centers, in my mind, are still they're not thought of first. I think that you just don't get any closer than senior centers at the ground level. But you look at a lot of these other state agencies that are providing services, but not that face-to-face like we are. So it just reminded me how much more that we need to be engaged as senior centers, especially on the state level with our Wisconsin Association of Senior Centers. In fact, I reached out to them to say, they didn't pull us in. They pulled in aging units, they pulled in ADRCs, and they might have mentioned senior centers once, but I think the criticalness of what we do, and it was proven during COVID, being there at the ground level and really seeing how people are doing on a daily basis was really important. So I did check on all the handouts and all the videos. That will be sent for those of us that attended via an email next week, because I couldn't get any more handouts. But then I'll just share them with all of you guys, because it's good information to share. So that's my little spiel. So, and I know, Ruth, you had you weren't able to come. You had work.
Right. I had intended to attend
Yes.
on Friday morning, and then I had to work with a client. So.
Yeah, no worries. Okay, how about you, Barb?
I attended, let's see, several sessions, the opening session, I listened to it.
Yeah.
And then three other sessions and the closing session. And first of all, I just was very impressed by the organization and the level of information that was provided. It once again reinforced my positive opinion of Wisconsin Extension and Wisconsin Idea and all that sort of stuff. I thought the presenters were very well trained. For a Zoom meeting, it went very smoothly. There were no glitches. The speakers, had the support they needed, even if they weren't experts in technology. They had support so that they could give their content without having to struggle with the technology. So all in all, for a virtual meeting, I thought it went very well. The first session that I attended, I thought the opening, the group meetings by the main speakers were interesting to me, but not being in the field, there was a lot of information that was passed on that maybe wasn't pertinent to me, but it was interesting to see how they communicated and how they reached out and included all these other organizations. And the level of training that was provided, I thought was very good. Especially the last session, which was on partnerships to maximize impact. It was called community collaboration. It was much more of I thought, kind of an introductory or basic training on how to work effectively in groups, especially across agencies, when you're not the line manager to say, I need this tomorrow. How do you get that cooperation? How do you get buy-in? How do you run a meeting? All those kinds of things that I think would be very, very helpful for people maybe who are just entering the field. Another one that I attended on the last day was vaccine hesitancy in older adults. I thought that was would be of interest. And of course, Dane County does not have a lot of hesitancy. And really what they did was compare it to flu vaccinations and looked at some of the reasons that people didn't want to get a vaccine and then how to counteract that. So it was interesting, but I think a lot of that had been rehashed in the media recently. So I didn't pick up anything new. They did talk about various campaigns using a trusted and known spokesperson to say, I got my vaccine, how about you, and that sort of thing. And the one that I found really the most interesting, is probably because it was all new to me, was on using data and evidence about healthy aging to promote health equity. And there is a U.S. database that compares counties across the country, health rankings in counties across the country, and it's accessible to anybody. It's called countyhealthrankings.org. And you can go on it and check out. So I printed out Dane County, for example. It rates the county to the state and the state to the nation. It has tremendous, it's really a wonderful site that would be very powerful, I think, for somebody looking to solve a problem. And I won't go on because I could, there's just a lot of detail there, but.
I can share, we can scan these in and I can share.
Yeah, I think the handouts from that one would be very interesting to everybody, but it's really interesting because it compares, as I said, county to state to nation. It picks the best, and then to the top U.S. counties, the best performing. And of course, Dane County does pretty well, except that I was struck by, and I don't understand this, a very high prevalence of HIV. And, but otherwise, Dane County really ranks right up there with the top performers, as well as, you might expect this, alcohol-impaired driving deaths and excessive drinking are higher than the national average, but lower than the state. And sexually transmitted infections. And I don't know what that's all about, but, or if it affects the senior population, but it was notable. Yeah. Yes, it was notable, anyway. But the other thing it does is it allows you to then find studies, research papers that have been written about various topics. And what's interesting is that it has a really powerful search engine, and you can drill down to almost any level of topic. And it kind of summarizes it for the layman. But there's a great deal of research information also available on how to tackle these, as well as information about community projects and so on. So anyway, it's countyhealthrankings.org.
Thank you, Barb. All right, Jim?
Well, I did take notes, but I'm not a good note taker, so I'm going to have to pick at these. So, at any rate, the one thing that really jumped out at me on this summit was as I was listening to all these presentations about kinds of things you should be doing, et cetera, Fitchburg and the Senior Center seems to be doing almost all of them already. Hats off to you, Jill. Hats off to the city. I'm very impressed with where we are, but I did get a lot of tips on things that we might look into as far as making us even better. The first session that they had, they talked about asking the community what are their needs, what do they expect us to provide, and I think that we've done several surveys about that already. But they mentioned the use of the internet as far as promoting things. I don't know if we use Facebook and all that tweeting and all that kind of stuff or not, but they seem to think that that would be an effective tool in modern society. So I jotted that one down. I attended the one breakout session called Developing Age-Friendly Communities. It was primarily provided by our representatives, and they did talk about isolation, and one of the things they talked about was a pen pal system, where seniors who are confined, maybe setting up a pen pal system might be something that would help people out. I know I'm doing a pen pal thing with my grandson through a magazine called Cricket, that was a thought that I thought, maybe we ought to look into. There's a age-friendly community network, and as I was listening to this, I thought, maybe we could have them come out here and evaluate the Fitchburg Senior Center, and then, of course, we would find out that we were gold star type material, and then after that, one of the things that we have in our next agenda item, Plan for Growth Update, if I remember right, is communication to the public. And if we came out and got a rating, then we could communicate that to our constituents that, hey, look, the Senior Center is really outstanding. You ought to come on over here and see what we're doing. I was thinking after we get the award, they're making a lot of assumptions here. But after we get the award, then we could have some morning TV thing, like on Channel 3, in the 608. Josh always goes around looking at interesting places. We could have him come in here and broadcast how great the Fitchburg Senior Center is. At any rate, how do you like my notes so far? There are several tools that they gave websites for. One of them is called, it's an assessment of isolation. And it's something that a person can do themselves, or like a family member could help to evaluate whether a person really is isolated. Some people can be alone and not feel isolated. And other people when they're alone, they really feel isolated. So this kind of assessment is a good thing that we could look into and evaluate. Another thing that they talked about was using teen groups. You know, teenagers are really highly technologically advanced, and using teen groups, intergenerational training for older folks who might feel a little uncomfortable about using the internet. That would be a good way of enhancing the use of technology. I attended my other two ones that I attended, and this gets into why I think we're so great. I attended session B1, evidence-based programs to reduce sedentary life. And they have all these programs that are provided that have been tested and et cetera, are so wonderful. It costs to train somebody, it costs like $300 to $800 to train a leader for it. But I kept thinking, each one of these things, like Tai Chi, we have Tai Chi available here. We have exercise things here. We have strength building here. We have all of these types of things already. So that session was mostly reinforcing how I feel about the senior center. The other one that I attended was brain health and aging, lost cause or lost opportunity. And as one that you went to, that's been rehashed so much, I didn't get anything new out of that one. But closing, I would like to say, I think we're doing a good job, but we can, there's always room for improvement.
Always, yeah.
Yep.
I just wanted to do a couple follow-ups, what Jim was saying. The evidence-based programs, I agree, and they talked a little bit about that in the PT-OT seminar. They talked about OT and PT for incontinence issues, and the mind over matter, healthy bowel, healthy bladder. We've done that many, many times.
Yep.
It is evidence-based. And we're offering a class actually at the end of this month, which is virtual. And so that's very exciting because some people still are a little bit uncomfortable talking about it or whatever, but it's not normal. Like, you can get help, but it always doesn't have to be surgery. So Mind Over Matter is evidence-based, and Dr. Heidi Brown developed it here at UW. And it's really just about changing your eating habits, there's different exercises you can do and that sort of thing. And it's a really great class. And they talked about that. They talked about Stepping On, which is a class we've offered over the years, and No Falls, because Wisconsin has the highest rate of falls for older adults. And just this week, an instructor reached out to us about doing a Stepping On class. So we'll probably be looking at that in the fall again. So the evidence-based classes, I agree with Jim. We do a lot of different, the Tai Chi and that kind of stuff. What they sort of promoted at state level is if you do the evidence-based classes, there seems to be more credibility with that. I don't always agree. I mean, I think there's a lot of credibility with what we do. But when you go to a funder or you do any sort of marketing, you say, this is evidence-based and we offer X number of evidence-based. So I try to strike a balance. I mean, I do think that there is definitely, positives about doing evidence-based programs, but sometimes there's just a lot of strings attached, and you really have to follow it to the T, or you can't miss a session. And so we've done Living Well with Chronic Disease, it's been many years, Healthy Living with Diabetes, it's been a couple years, but there are some really good classes that do fall under that evidence-based class. And then the other thing, you talked about the teen IT support. Dave just reached out. It's a little challenging here without school districts, to connect with students, but Dave just put something out on the Fitchburg's Next Door neighborhood, Next Door, I think it's that neighborhood website, looking for high school volunteers to do IT support for older adults. So, because I do like that, incorporating the youth, and we've had that in the past. It's been a while, though, so I'm happy to hopefully bring that back. And then the other thing I wanted to mention was the age-friendly communities. Linda's camping, and so she was going to try to do internet connection, and I said, it's okay, I think we'll be able to, I can report what you have. So she actually sent me a report that I'm going to share with you guys, because she attended the age-friendly communities. Let's see, where's hers? There it is. Okay. There it is. So this is her report. Let me get my screen up here. And, this is something that I have been looking at for several years. And poor Linda's not here to defend herself, but I said to her, I think after the last meeting, would you be a champion of this for us? Because I think as we start our plan for growth again, a lot of these age-friendly concepts should be incorporated. And also, too, it should be incorporated into what they're doing up at the hub. Because age-friendly isn't just about older adults, it's about people with disabilities, and it can be about, youth and stuff. But, so she put this together for us, and I think it's no surprise that, the older adult population is exploding. 2060 is a far way away, but in between 1960 and 2060, we're going to have a lot of growth. We're going to have a lot of growth in the next 10 to 20 years. So this kind of information is important for us to hold on to as we look at our plan for growth. She's got, this may create a challenge to provide services with special needs, but suggests a need to integrate with all ages within the community, and that's what we're talking about too. This next example here, Livable Communities, it really focuses on, I gotta get this out of here, there we go, is the livability indexes. And this is something that Wade Thompson in Planning and Zoning, when he came to present to us about the hub, and when he talked about the Healthy Neighborhood Initiative, these were the indexes that they used to determine which areas needed more support, and again, this is for all ages, but I think as we move forward with our plan for growth, we want to look at the housing, the social, the outdoor spaces, transportation, health services, social inclusion, civic participation, communication. So these are all topics we talk about all the time, but this kind of just confirms we're on the right track if we continue to focus in on these domains. So good information there, and Linda's outlined too, housing is the affordability and accessibility, outdoor spaces. I think we learned more than ever during COVID that being outdoors is really important for a lot of different reasons. And I think there's been a lot of people that learn to enjoy the outdoors more than they ever thought. And we talked about that with the patio out there. And I know Jim's Men Group was meeting at McKee Farms Park yesterday, and McGaw. So just utilizing the spaces we have, kind of looking at, that's kind of a senior center without walls too. Transportation, huge issue. Communication and information, just as Jim spoke of. We do have a Facebook page, we have a city website, and a city Facebook page that promotes our things, and then we have a senior center website through the city, but we do have our own Facebook page. Marcia, are you guys active with your Facebook page? Yeah, Friends are active with their Facebook page, so we don't have any Twitter. The more social media accounts you have, you almost have to have an assigned staff full-time to keep it updated. And I'm not, I'm not a big user of social media, so I probably should get better at it. Thank God David and Mandy are. So other things, respect and social inclusion. We're not strong on intergenerational, and I think that is a place that we can improve. Not to make excuses, but it is kind of unique when you don't have a school district, and kids are from all over the place. But there is room definitely for improvement. Health services, again, I feel good about the connections we have and the partnerships. There's so much potential within Madison and all of our medical communities and our providers in the area. I did find my other notes from my first session, and I wrote down, maybe when we build a new center, that we put a little room for rehab services, because I know Princeton Club did that, I think, years ago. But, there's a really nice partnership when people are just coming in for a little PT, and maybe they stay for lunch, or maybe they join our exercise class and that sort of stuff. So, that might be for another director, but I think it should be explored as we move in our plan for growth. And I'm talking 15, 20 years, but it's time to start talking about these things now. And then social participation, which is obviously been highlighted more than ever this year. And Jim's right. You can be alone and not be lonely, or you could be surrounded by people and feel lonely. So identifying what that means to each person, and then how do we help that person. So anyway, this was Linda's report, and I appreciate her sharing that too. So, all right. And then, like I said, I'll get all the handouts, and I will share everything with you guys, because you can also watch the presentations. So if you want to, just log on and, yeah.
I just wanted to add that I thought falls was universally discussed for all areas of the state, and transportation. Everybody struggles with transportation. So it's not just a Fitchburg thing, which means that you should be able to get cross-community collaboration if everyone has those same problems.
I was going to bring this up at the end, but you're talking about transportation as a universal problem. I just filled out, the city of Fitchburg sent out a survey about transportation and the direction we should be going. And the survey only takes like 10, 15 minutes to do, but it really looks at a lot of different aspects of transportation. So I'd encourage you to do the survey as a citizen to provide input for the transportation department.
That's a good point. And I'll forward it to all the board members, and to you, Marcia, too, maybe to forward on to the Friends.
Yes, I've already forwarded it I received it and then forwarded it to the board members.
Okay, let's proceed on then to our next item, which would be the plan for growth update.
Okay, so we had a really productive kind of brainstorming session, and those that have agreed to participate in our plan for growth work group, we're going to call it, is Barb Rotman, Linda Gorschels, Ruth, and Nan Hoffman representing the Friends. And so I sort of had a loose agenda to go over, our last plan for growth and where we at and where are we going. And after a lot of conversation just all over the place, we all honed in on a mission statement, like looking at our mission statement again and maybe scaling it back. It's relatively long, but kind of just going back to ground zero, and then being able to look at a plan of growth based on a mission statement that's really clear and concise, because ours is, helping older adults remain active and independent and giving them the volunteer opportunities. And it's just, very, very wordy. And so I think we had a great discussion, and I think it's going to be a good group. I said, we don't have a strict timeline. We're going to meet monthly. And so we'll come back, I think, in 2 weeks and talk about what that mission statement might look like. And then that mission statement would come back to the Commission on Aging for approval, for sure, and certainly involve the Friends' input as well. Barbara, Ruth, do you have any comments?
I don't have any comments with regard to the discussion, but I think the fact that we determined that we need to have a more specific mission statement and work from there will really, really help. So, forward to that.
I was on the original plan for growth, and I think there were like almost 25 people on it. It was very, very representative. But sometimes when you get so many people, it's hard to really get focused. And I commend your group now, the new group, that it's a smaller group and you can kind of get down to hammering things out a little more effectively. Okay, Marcia is here from the Senior Center Friends for their report. Marcia.
Yes, thanks. The Friends spent $675 on special needs in the past month, basically the month of May. And that covered some rent, utility bill, and telephone bill for several seniors. As you probably know, the Friends are a fundraising group, and that's been virtually impossible during COVID. And we look forward to September when the National Senior Center Month is celebrated. We're looking at ideas of what we could do to celebrate it and also, raise some funds. We've been able to continue to help all the clients that needed help, though, this past over a year. Travel has been, in the past, a big fundraiser for us, and I'm told that people are still calling and asking about some of the tours that have been scheduled. They're sent the flyers, either paper copies or virtually through the email, but they're not signing up yet. So we recently learned that the tour that was scheduled to go to Western Canada, Vancouver and Victoria in late July has been officially canceled, but they have another date when they're planning to go in September, which is National Senior Center Month. Also the tour to Mount Rushmore and the Badlands, which was scheduled to go this early fall, has been canceled. So there is a later date for Western Canada, September 17th. The pancake breakfast, which has been mentioned at a previous by Judith Hirsch, our 10% amounted to $81.18, which is not a lot, but if you think about it, our partnership with Hy-Vee Market Grill brought in to them over $800 on a Sunday, one day. And that was a big deal for them. We did overwhelm them, even though we had warned them. Seniors like to eat out. So anyway, another item I wanted to mention was that a board member, Bill Horns, has been on the Transit and Transportation Commission for the last probably at least a year, and he has recently been elected chair. So there's not a lot of priority given to, like as usual, priority given to how can we get people to the senior center, but his presence on the board, on that commission will certainly, hopefully, once in a while bring things up. Membership. We need to replace 5 board members, some that are rolling off after 3 years, one that's rolling off after 6 years. And so anyway, we are looking for new board members. We have a membership committee that's working on it. They have some names, but if you know of anyone who would like to possibly be on this board, we would greatly appreciate that. It will start, their term would start in October. And that's about any questions?
And they're 3-year terms too, right, Marcia?
Correct,
Yeah, and you can re-up one time.
yes.
So for those that you don't know, Marcia is the chair of the Friends
Correct.
for how many years? Feels like 100?
100, yeah.
Yeah.
No, this is my second year, and I stayed on a second year because of COVID.
Yeah. And I just want to say, she is fabulous and has done a fabulous job during COVID, doing the Zoom meetings. You got so well. She runs a meeting like any high executive. Like, she knew way more about Zoom before I did. And you do a great job. And
Thanks.
so she's going to be representing the Friends now at the meetings moving forward. Judith is going to take a break. So thanks for coming today.
Sure.
Yeah.
Real good. Thank you very much, Marcia. Okay, time for the director's report, Jill.
All right. Okay, so as Donna and I were talking, when Dane County dropped their mask mandate on June 2nd, we opened our doors. There was some discussion about rolling things in kind of slowly, but we kind of practiced with that in May. And, as a staff, we just kind of decided we're just going to open the doors. We're not going to pick and choose which programs to bring back, which ones not to, because everybody has a different opinion about what's safe and what's not safe. And so I just felt like you're all older adults and responsible. Make your own decisions. I don't want to do that for you. I told Donna, oftentimes when you're talking to other professionals, they look at the senior center as, oh, these frail older adults, you have to keep them safe. And I was like, that is such a terrible stereotype. Our people are well-educated and they can make their own decisions. And so certainly there's a few that, we might, have more input on their decision-making, but for the majority, you guys can make your own decisions. So we opened our doors. And this week, you wouldn't even know there was COVID. People were so happy to come back. And so then I was like, oh boy. But it's not like they're not busting down the doors. I mean, we did have 13 for lunch yesterday, which was rather surprising. We are the only site in Dane County that is open for lunch right now. But our push was a little different because, as you recall, we really struggled getting drivers for home-delivered meals, that we had to reduce. We actually had to go through and take off some people for home delivered because we just couldn't fill that route. And some of these people were our congregate regulars. So the sooner we could bring back our congregate regulars, our home delivered route declined. And so then now we're serving everybody again. So our push was kind of based on that. Like, we want everybody to be eating again. We were making sure those that weren't getting that meal on Wednesday, maybe had 2 meals from Little John's on Tuesday. Nobody was starving by any means, but it just feels good to now be kind of back in action. So I feel good about opening up. We still are doing a lot of advanced registration, which, it gives us peace of mind to know who's coming in the doors. We've, especially the aerobics and functional fitness, and it just feels better to have people register. And so that's going really well. I talked about the students that I'm still working with a couple med students now that are doing, they're helping me put together a webinar. Joe Parisi, the county executive, called together a task force in Dane County called Deaths by Despair. And it was a suicide prevention sort of campaign that dealt with suicide and a lot of opioid overdoses and how do we reduce those. And so I'm sort of representing the senior community on this. And so the 2 students I'm working with are really helping me get a lot of statistics about suicide in older adults. That's not something we deal with every day. it's been really interesting. And like I said, the other students are gone now, so, and we'll just start working with the Edgewood students again in the fall. For those that maybe didn't see in the newsletter, the Juneteenth celebration that we're doing next week on Wednesday, June 16th, from 12 to 1. Thanks to Susie Jones, our office manager, she put together this program. She reached out to the owner of Melly Mel's Soul Food, and they'll be doing a catering lunch for us. Fried chicken, baked mac and cheese, collard greens with smoked turkey, cornbread, velvet cake, and strawberry soda. Through some of our memorial funds, we are subsidizing the cost for 60 and over. It's $10. For those under 60, it's $15. You can make your reservation by, looks like tomorrow, but usually we can extend that a couple days. So you can go online, sign up. You can eat at the senior center, or you can do a takeout. So anyway, we're excited about that program, and just sort of our goal of increasing, awareness and cultural diversity, and just education. I talked to finance, and I made a decision to take the patio out of the capital improvement plan because I just didn't have my ducks in a row. There really is nothing. It's way more complicated, particularly when we incorporate the standards, the architectural review with ProMega. When I got the packet of information, it really made me pause because there's a lot of things that I have to meet to make sure that they will approve such a design. It's not as simple as throwing out a concrete slab and putting some furniture on, which I was hoping. And so there's a lot of landscaping that needs to be looked at and approved. And so I just told the finance director, just take it out, and I'll do a little bit better, forward planning about that. So we are taking that off. But I'm working on it now. I'm going to reach out to actually a retired landscape architect to help me kind of move forward. I'm doing a lot of work on updating our job descriptions. It's been about 10 years, and so that's taking some time, but it's long overdue. You'll start to hear me talk more about county funding coming down the pike. We'll be looking at, increasing that funding, or at least hopefully maintaining it for case management and nutrition. So that starts pretty quickly. Also, if you saw in the newsletter, we're going to try the partnership with Hy-Vee it's called My Meal, My Way. This is a program that has been piloted. Well, it's not even piloted anymore, that other communities have been doing for a couple years. And it hosts, you pick a restaurant in your community, and they're sort of your host meal site for the day. So Hy-Vee came forward and offered to do this. They're doing it here. They're doing it, I think, off of Whitney. There's a Hy-Vee off of Whitney, and then there's one on the east side. So starting July 7th on Wednesdays, we no longer will have a congregate meal here. Now, we will be sending out home delivered, so we still need the volunteers in the kitchen. But if you want a congregate meal that day, you go to Hy-Vee between 10 and 1. They will have a limited menu that you will choose from. You will check in. There'll be a staff person there, and you'll tell them, I'm here for My Meal, My Way. They give you a limited menu. Can be breakfast or lunch, and then you can order off of that menu and make a donation just like you would here. And so it's kind of unique, and I'm going to say I resisted this concept for many years because I didn't like the idea of taking people away from our meal site, because oftentimes they come here. Wednesday's an exercise day. We have a lot of functional fitness participants that came for exercise and stayed for lunch. And so I wasn't real fond of it, but I'm trying to open up my mind to, there's a lot of frail older adults that never get to go out to eat, ever, because of cost or transportation or whatever. And so maybe this will be fun for them to be able to do that. There's probably still some kinks to work out, but the bus that brought them here will be a bus that takes them there. So they would just call us and say, I need a ride to Hy-Vee, and so we can still transport everybody over to Hy-Vee for lunch. So we'll see how that goes. You have a question?
I was just going to ask about the bus, and you answered it, so.
Yeah, so it'll probably be pretty popular, and also probably another positive is that there'll probably be people that would never come here anyway, and that they will go there to eat at Hy-Vee. And so, if we have our marketing brochures there and our newsletter, it's just another way to expose us to a population that might not come to the senior center because they're not old enough. So that starts on July 7th. We did a plea for meal drivers, and we're good in that there, but we are looking at trying to recruit some more RSVP drivers for medical appointments. Some of our drivers are not coming back. We're slowly opening that back up, to get people to their medical appointments. RSVP has their own policy about driving, and people do still, the drivers have to wear masks and the riders have to wear masks, but we are looking for some drivers that would be willing to take people to medical rides. And then the last thing I wanted to talk about, I'm going to share my screen, is housing and the growth of housing coming down the pike. And this is going to play into our plan for growth as well. So let me get this quick. There it is. Okay. So for you guys here, sorry, I have this printed out. All right, Ruth, can you see that? Okay, so I have it up on the screen. Is that good enough, Ruth? Let me see if I can make it bigger. Look at Ruth trying to find, look at that. How's that? Let's see. Then yeah. Yeah, okay, there we go. All right, so I have been thinking a ton about this because this was really the catalyst for the plan for growth, because there are so many senior apartments coming down the pike, and we've seen the impact of Highline, and I just want everybody else to be aware of this. So on the top, the first 5 lines is our current senior apartments here in Fitchburg. So McKee Park and Chapel Valley are both on Chapel Valley Road. So McKee Park is affordable, it's 42 units. And then Chapel Valley has the 2 buildings. Oh, what am I got here, 11. Chapel Valley has about 50 units per building. I think I missed a 0 there. I think it's 110. Neither of those have any assisted living. That is all independent living. But sometimes that's an oxymoron for senior housing. They say independent living, but people still need our help, and we serve a lot of people here. Both of those buildings are not on a regular bus line, but they are close enough to the regular bus line within a quarter mile that people couldn't use Metro Plus to get around. And so that's the wheelchair accessible door-to-door service that follows a regular route, a regular bus route. So folks, you do have to qualify. You have to actually go down and do an appointment with Metro to see if you qualify. But some of our folks do use Metro Plus in those buildings, and that's a door-to-door call, a couple days in advance, and we'll take you where you need to go. Moving down is the Highline, 160 units, and we have seen the impact of that. Now we have some people coming for lunch. We're doing some home-delivered meals, and there's some needs there, and they're keeping our social workers pretty busy. The Waterford has been around for quite some time. They started out years ago as condos that you could purchase, and then they just kind of evolved over the years. They haven't always been called the Waterford, but they have 82 apartments. And I say that they fluctuate between independent living and assisted living. So, and that is the case. You can move in there independently, and then you can add more and more services, and then it's more assisted living. It's a beautiful facility. They do have their own bus. So I would say, because a lot of the folks that move in independently and kind of move towards their assisted living in-house, we don't have a ton of services up there. They don't have a ton of need for us because they have nurses and they have staff up there. And then Avalon is another RCAC, which is a residential care apartment complex. That's what that means. Again, we don't do a ton with Avalon. They're kind of self-sufficient up there. They do accept family care, which is kind of nice, so that makes it affordable for people. So moving down, Quarry Ridge Resort Lifestyle. I think I've talked about that before. That's being built right now, 128 independent units, rather on the pricey side. But that's going to bring in 128 people or more because couples might move in, and that will open next spring. River Song is a go. It's going to be over by Terra Vesa, kind of, I think, near the new Oregon School, up in that area, in Uptown. So that's a combination of an independent living, 125 units, and then 60 assisted living units. So they break ground in this fall. After talking to the city planner, usually it's like almost about 18 months before things are up and running after the ground is broken to start the building. So we've got a little time there. Novation Senior Commons is an affordable senior living, independent living apartment in the town of Madison that we will be taking on this fall, or no, I'm sorry, next fall. 2022, yeah. And that's been built, I would say maybe 5 years ago. It's a relatively new senior apartment complex over there. The Courtyard Senior Living, this is being proposed right down on Brendan, I think, right by McKee Farms Park, right by the tennis courts. I don't have a lot of information because it's in such the early planning stages, but they did have a community meeting, and I learned this week that it went very well. There's a little bit of resistance, not a ton from that community. If they're going to build, most people feel like that's a good fit. To have seniors living in that area, which I had to laugh because Chapel Valley Road, that's going to be like a seniors, lots of older adults on Chapel Valley. But anyway, and then Limerick, which I don't know how I missed this one, but the ground got broken this week. They did a groundbreaking, and they have 100 units set aside that are affordable for older adults. And so that's coming next fall as well. And that's on the corner of Sain and Lacey, right by the roundabout. And so anyway, it just has me in a state of how are we going to serve all of these older adults? Meals, transportation, and case management are my main concerns. Transportation actually being number one, because if people want to get here, we have one county bus available to us. And again, none of these centers, even the ones that have Metro Plus, nobody comes down this way to the city campus. So that's my first concern. My second concern is staffing. Now it is in my budget that we will be adding a full-time social worker in July of 2022. That was something that as the city started to plan for town of Madison a long time ago, they said, what staffing would you need? And I said, another social worker. So, there's no guarantee it's gonna pass, but it is in the budget right now, which I think our budget for 2022, the papers come out this month. So we'll start working on that. So that social work piece, I feel a little bit more relieved that we will be, hopefully, have another social worker on staff. And then mostly home-delivered meals. I think we learned during COVID, with 50 people on meals all over a 35 square foot mile radius in Fitchburg, it took 6 drivers every single day. That was difficult, but on top of that, it's difficult to put that many meals together in our small kitchen. And so again, things that we start to think about as we do our plan for growth. So I just wanted to share this today with you. I think it will be more pertinent as we, our work group, moves forward too with our plan for growth. So that's where we're at. I remember, 5 years ago, like there's just no senior housing, and then all of a sudden there's a lot coming down the pike, which is great, but I want to be prepared. I don't want to panic and throw in a CIP patio like I did and not be prepared. So this feels better to talk about it with all of you. So any questions? Ruth? I think,
I'm on mute?
you're good.
Okay. I would recommend for lines 9 through whatever your new developments, that you add a column that states who the developer is.
Okay.
And that we push for communication with that developer. They will give you someone to work with or to talk to. But now that they're in the planning stage, although I know that Quarry Ridge is maybe beyond that, but we need to bring them into the conversation now so that they understand that we want to work with them because we know that their residents will be using the Fitchburg Senior Center, and see if they can come up with something that might help. For example, a bus, you know, from their particular development.
Those are great ideas, Ruth. I was thinking about that too, thinking, and I don't know enough about how developers work, but I feel like when they develop different apartments, and correct me if I'm wrong, somebody probably will after the meeting, but isn't there parkland that they have to provide, or, you know, space for playgrounds? Does that sound right, Ruth? Would you know?
Well, developers need, I mean, in the city plan, after so much acreage, they need to develop a playground.
Okay,
Yes,
that's it,
but
okay.
not for senior living.
Right. Well, we could make it an accessible one if we want to just choose a different angle.
But I think that their involvement, or at least our involvement in their development, just for services and that sort of thing, needs to be talked about before they have an open house and then they're up to their eyeballs and new people doing applications and stuff.
Okay, that's a great suggestion, thank you. Anybody else have a question, comment?
One other thing that I'd like to say is when we look at the column independent units, I know for a fact that in the Waterford, there's 82, but some of those are like 2-bedroom and, you know, there's more than 82 people.
Right.
So
All
you
of
could
them,
be looking
actually.
at 160 people there.
Correct, right. No, you're absolutely right, yeah.
One other question that comes to mind, and I don't know if it makes much difference to our planning or our connection to the population, but are these all on a rental basis, or are there any owner-occupied units?
These are all rental.
All rental? Okay,
Yep.
thank you.
And there's even one more that I got wind of at the last city meeting. And this, it's a long stretch of land on Sherrill. I don't know the crossroads. Go past hospice, probably a half a mile. And it's just a large, like, vacant lot, several blocks long. And years ago, I sat on a committee that wanted to build senior housing there. Actually, it was for seniors and people with disabilities that were 18 and over. And it was a concept of where you build a housing unit, and the people that cared for the residents, they lived either on the upper level or the lower level. So they were proposing that, like these individual, sort of like a duplex, and then they were proposing a large senior apartment complex. I don't think that that's the case anymore, but it's something that we keep our eye on because it's coming back up for discussion. And there was still some discussion about people in assisted living, but who knows? So I'll kind of keep my ear open for what they might develop over there. So,
Jill, what about the senior housing over by Target?
the luxury one?
Okay.
Yeah, so that one is that's the Quarry Ridge Resort Lifestyle. That's the first one. There's also, Ruth, they're also opening pretty soon is workforce housing right across, kind of on the other side of the street from Target. But the Quarry Ridge is already built, at least the exterior. That's the
Yeah,
luxury one.
Isn't that on Fitchburg Road?
Yeah, but you have to go through the roundabout, and it's right when you start working your way up to Target, it's on the left. So actually, it looks like some of those windows look right at the back of Target. Yeah.
Okay, any further questions for Jill? Okay, our next meeting will be on July 8th. Are there any last-minute announcements or comments? If not, do I hear a motion for adjournment?
So moved.
Second.
All in favor?
Aye.
Opposed? Meeting adjourned.